How does communication with the partner affect sexual satisfaction? What are the differences between sex and gender? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Communication with the partner is fundamental for sexual satisfaction. Openness and honesty in expressing needs, desires, and boundaries strengthen intimate connection. Effective communication allows understanding and addressing both parties' expectations, creating an environment of trust and understanding. Sex refers to biological characteristics, such as genitals and chromosomes, used to classify people as male or female. Gender refers to social, cultural, and psychological characteristics that a society associates with male and female roles. Differences between sex and gender are important and may not align in all individuals. Acquired premature ejaculation. Although primary premature ejaculation occurs from the onset of sexual activity, acquired premature ejaculation may develop later in life due to factors such as stress, anxiety, or relationship issues. Adaptation in sexual therapy. Some sexual therapists use principles of the Kama Sutra in their practices to help couples overcome sexual issues, enhance intimacy, and revitalize their sex lives. In many African countries, sex education often faces challenges due to lack of resources and prevalence of conservative cultural norms. However, there are efforts to provide information about HIV/AIDS and other sexually transmitted diseases through community education programs and awareness campaigns. Age and erectile dysfunction. Although more common in older men, erectile dysfunction is not exclusive to advanced age. Men of all ages can experience it due to a variety of factors, including physical and psychological issues. Alcohol and drug effects. Excessive alcohol consumption and certain drug use can affect sexual function in men, sometimes making it challenging to achieve orgasm. Amputation fetishism. Although less common, some individuals experience sexual arousal towards individuals with amputated limbs, known as amputation fetishism. Anal sex and pregnancy. Anal sex does not lead to pregnancy, but it is important to practice contraceptive methods if the couple does not wish to conceive. Ancient history. Sex toys have a long history dating back thousands of years. Artifacts have been found from ancient Greece and Rome that are believed to have been used for sexual stimulation. Anorgasmia and communication with partner. Open and honest communication with the partner about sexual needs and preferences may be crucial in overcoming anorgasmia and improving sexual satisfaction in the relationship. Anorgasmia and pain disorders. Some individuals experience pain during sex, which can hinder the ability to reach orgasm. Effectively treating pain disorders can help improve sexual response. Anorgasmia and pelvic trauma. Traumatic injuries in the pelvic region, such as those sustained in car accidents or falls, can cause nerve and tissue damage, affecting sexual response and potentially causing anorgasmia. Changes in sexuality with age. Sexuality can change throughout life due to factors such as aging, physical and mental health, and hormonal changes. It is important to adapt to these changes and find new ways to enjoy sexual intimacy. Child access. Despite efforts to restrict access to pornography for minors, many children and adolescents still have access to online pornographic content, raising concerns about their sexual education and emotional well-being. Communication. The ability to communicate effectively and actively listen is important. Women often value open and honest communication in a relationship. Comprehensive sexual education. Comprehensive sexual education addresses a wide range of topics related to sexuality, including anatomy, reproduction, healthy relationships, consent, contraception, and prevention of sexually transmitted diseases, with the aim of promoting healthy and safe sexuality. Concept of fluid sexual orientation. Some people experience changes in their sexual orientation throughout their lives, reflecting the fluidity and diversity of human sexuality. Conscious breathing. Practicing conscious breathing during foreplay can help improve the connection between partners and intensify the sensation of pleasure by synchronizing breathing and heart rate. Continued research. As the factors contributing to premature ejaculation are better understood, researchers continue to develop new treatment and management methods for this common sexual disorder. Couples pornography consumption. Some couples watch pornography together as a way to explore fantasies, increase arousal, and enhance sexual communication, as long as it's consensual and respectful. Cultural differences. What is considered a fetish can vary across cultures. For example, in Japan, cosplay culture, dressing up as fictional characters, is widely accepted and can be a way to express sexual fantasies. Cultural differences in sex education. Cultural differences influence the sex education received by individuals, including messages about sexuality, sexual pleasure, and acceptable sexual practices. Cultural diversity. Pornography reflects a wide cultural diversity, with productions varying according to the preferences and taboos of different regions of the world, providing a window into the sexual expressions of diverse cultures. Dance skills. The ability to dance can be attractive as it shows coordination, rhythm, and fun. Distraction. Techniques. Some men use distraction techniques, such as thinking about something unrelated to sex, to delay ejaculation and prolong pleasure during sexual intercourse. Diversity of genitals. The shape and size of genitals can vary widely among different individuals, reflecting the natural diversity of the human body. Dry orgasm. In addition to dry orgasms mentioned earlier, some men may experience retrograde ejaculation, where semen enters the bladder instead of being ejaculated outward. This is not harmful, but may affect fertility. Dual stimulation toys. Toys designed to provide simultaneous stimulation of the clitoris and G-spot, such as rabbit vibrators, are popular among women and can lead to more intense and satisfying orgasms. Effects of wet dreams, or nocturnal emissions are involuntary orgasms that occur during sleep. They are often related to erotic dreams and are more common in men. Effects on relationship. Excessive pornography consumption can affect relationships, as some studies suggest it may decrease sexual satisfaction and emotional intimacy. Empathy. The ability to show empathy and understanding towards the feelings and needs of others can be an attractive trait in a man. Erectile dysfunction and acupuncture. Some studies suggest that acupuncture may be beneficial for improving erectile function by increasing blood flow to the penis and reducing anxiety. Erectile dysfunction and cognitive behavioral therapy. Cognitive behavioral therapy, CBT, can help men identify and change negative or anxious thought patterns related to sexual performance, which may improve erectile function. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.